done, in every case that you do, is completely the wrong situation. And that is something that happened in my country either. So actually, we should go sometime back to the basics, starting again from the facial analysis, but then going to dental label analysis. Dental label analysis, you're getting closer to the target. Getting closer to the target, starting with examining all the dental label parameters, starting with the tooth exposure at rest. That is the most convex area of the incisal edge. So the position of the incisal edge should be the starting point of our prosthetic work all the time. All the time. When you do this kind of procedure, of course, that becomes the starting point and the starting step of the prosthetic treatment plan. And then you can have the perfect situation of the gingival outline, maybe. We see, depending on the smile line of the patient, as I already said. But the starting point should be the determination of the incisal edge position. And that is absolutely very important. I believe that this concept is very clear to everybody in this room. But at the same time, I would like to say that is very classic to optimize this kind of occlusal plane position, having the chance to follow some kind of very basic rules. You position on, for example, denture, and you move on the wax in 1 second. You put the perfect position of the central incisor, the cuspid, in the first molar. In this way, you can create the perfect occlusal plane. Easy to be done in denture. Takes seconds, no more than that. What about the fixed pros? It will be much more complicated most of the time. Yes, that doesn't mean that it's impossible. It means that you have to follow the same concept, of course, with more difficulties that can be met during the way that you do it. Of course, the starting point should be that. And most of the time, you have to remember that because it's not so well defined. So many times you have a very bad situation because of, for example, as I already anticipated to you, we have a lot of people that have already with worn dentition. So this guy that his name is Max. Max is a golf player. That is what he's doing in his life. Just playing golf. Nice. But at the same time, he come to me to say, I want to fix my teeth. So I was looking at him, talking. And when I'm looking, I was talking. I was thinking, teeth? Yeah, not teeth. It's just having the two denture. No denture not needed because you have the teeth underneath. Not visible at all. Why? Because it was completely shortened. We lost a lot of volume, not just height, also volume. So at this point, you should determine how to position the new solution of your teeth, how to lengthen it, how much you do lengthen it, and which are the parameters that are to be followed to optimize the change that you want to do it in this patient. So where the teeth are, they are lost in space. You have to find the way how to fix it, how to find it. And for example, in this case, you can say, I would put my incisal edge more or less like that. Or maybe like that. Or maybe like that. How many positions you can find it? How many you want it? But the one that is acceptable has to be found by yourself, looking at different parameters. So, as I said, the incisal edge position, the tooth proportion, the tooth exposure at rest, the smile line, the width and length ratio of the anteriors, the mandibular position, the phonetics, and also the functional parameters. So all these steps are to be followed, are to be, known and followed in order to find the initial position of your teeth. So we said at the beginning, incisal position is the starting point of our treatment plan. And on the top of them, we have the tooth exposure at rest. Tooth exposure at rest is a very important parameter. So if you look at these three drawings over there, nobody in the world, not here, not in Italy, not in Europe anyway, no one has different kind of taste. That on the right side is not the one that you want to achieve. Of course, is a sign of aging. And normally it happens when you, of course, are not young young lady or young guy, but is, of course, a kind of old guy normally, old lady. And that is something that you don't like because you don't show anymore the upper teeth. You just showing the lower teeth. So, as Vigen Brundo stated in the many years ago already, also Arnett, other articles also coming out of the same way, you should have a kind of final outcome showing on the inside of the tooth exposure at rest between 1 to 5 millimeters of tooth exposure. 1 to 5 depending on the age and sex of the patient. Young lady showing maybe 3.5, 4 millimeters, easy to do that. On the old man, you can show maybe not showing at all. Our goal is that to recreate a kind of length and volume that can be occupy maybe some part of this area and having achieved maybe some visibility, like 0.5, 1 millimeter is already good, just to show that you have teeth underneath, not empty mouth. That is important to know. So that is it will be the starting point of our evaluation, starting from that and arriving to show some part, that is the goal. The goal together with the smile line. In the meantime, we have inside of this position, in the relation of the age, you see how they change completely, showing the upper teeth at the beginning, it's just only the lower arch, and at the opposite, on aging, of course, you can show more the lower than the upper. So the starting point of a lady on the 50s, showing just the lowers. At that point, we have added just on the right side some new volume of the teeth. That length that was added is something that can be in some way utilized to have some visibility, like 1.5 millimeter visibility right now. And that is something that is in contrast with the left part of the upper teeth, the upper lip, that is not showing any teeth underneath. So that is important to know. Inside that position, again, you should be, depending on the class of the patient, Class 1, Class 2, Class 3 will be different. Class 2 will be more convex. Class 3 will be more flat. But anyway, the incisal position should be more or less parallel to the lower lip line, that is concave. So shouldn't be flat, shouldn't be reverse smile, as you have seen here in this case. So that's going to be the final work once more, starting with the visibility also the lower, now visibility on the upper, that was covering the lower arch. In this case, not just because we have added some upper teeth on anteriors, but just because we have rehabilitated the patient. In this way, we have the situation that was then with the smile line, that was between average to high smile line. It will be possible to see the convexity of the incisal edge once more. And overall, we should be also aware that when you increase the length of the anteriors, you don't do that just for aesthetic reason, but you do that also for functional reason, in order to have a kind of anterior guidance that can be ready and possible to exclude the posterior teeth during excursive movements. That is our goal all the time. As already anticipated to you, of course, it's much easier to do that with the denture. So let me show you this case in which I have tested, I've used a kind of wax in order to really move the teeth over the wax in a very rapid way. Just second, or just a few minutes, that's all. And you can try as you like it, more longer, shorter, and of course you can test directly in the patient mouth, looking the lips around the teeth. And this way you can, at this point, be able to see what about the tooth exposure at rest, for example, is sufficient or not. So that was done in 2009. And then again, that was before with the previous denture the patient had, that when she came to us. And secondly, when I modified that, at this point you can see that, you can see the incisal position seem to be more appropriate, showing a part of the upper teeth, having the chance to reduce the aging effect of the disappearance of this incisal edge. So it's also interesting because then we did the kind of surgical compensation. Massimo Simeon, very well-known orthodontic surgeon, from Milan was doing this kind of work, creating for me some newborn a position, and that was, long time after